Hello, my name is Dr. Mike Geil. I'm a general dentist in the Seattle area. I've been practicing in private practice for about 12 years. Today we're going to be demonstrating the Cadent iTero digital impression system, and we have a patient to show you. We're working in the upper left doing crowns on teeth number 14 and 15 and showing you how it will replace the conventional impression technique. Hi Lori, welcome to the office.
Hi.
How are you today?
Good, how are you?
Doing great. We're working on the upper left two teeth today, your back molars, number 14 and 15. Doing some crowns on there for you today. Any questions, concerns about what's going to happen?
No.
Okay.
I'm ready.
Excellent. Well, first part, we're going to get you good and numb so you don't feel anything at all. If, as we're working, you do feel anything, of course, let us know because we want to make sure you're as comfortable as possible. We're going to use a rubber dam and then make our noise. If there's anything we can do to make you more comfortable, be sure and let us know. Rubber dam's on. At this point, we're going to start preparation, removing the existing crowns that are there. And if you feel anything, you be sure and let me know. Okay. We've prepared both the teeth the best we can with the rubber dam on. We're going to start our tissue management, which we feel is about the most important thing with the Cadent iTero digital impression machine. It's important to be able to see what you're doing. I tell people to think like the camera. With the rubber dam on, we can get started a little bit. I'm actually going to, the crown that she had was very deep, went down below the gum line. Just going to reshape the tissue a little bit with electrosurge just to get it out of the way. It's granulation tissue. It's not what we want anyways. So we'll do that, and then we'll take the rubber dam off and finish any preparation we need. We've removed any excess tissue. We've got the preparations completed, completely done, checked our clearance, we've got what we want there. We're going to go ahead and start doing cord. We do a 2-cord technique. We're going to start with the first one, make sure tissue's in good shape, make sure our margins are where we want them, and then we'll go to the second cord. At this point, we've brought the Cadent iTero digital scanner into the room. We're ready to move ahead. Patient's prepared, and we start by creating a lab slip. In any case that you do, you use a lab slip, send it to the lab. They've created one that has several different fields that are required that guide you through the mouth when you're taking the digital impression. You select the teeth, or tooth or teeth in this case. You can do bridges, you can do pretty much any type of restoration that you'd like. There are some required fields which the lab loves. You have to tell them the date that you need it back, the type of material you're using, if you're using a metal, which type of metal. The shade is required. If you're doing pressable ceramics, a stump shade is required. So those are things I talk to the labs that they commonly call saying we don't have this and you can't proceed without having those in. Anyways, that's set there. We're going to go to our scan. And I'll have my assistant pull the cord out as we get the camera ready to take the pictures. You heard the machine talking. It is talking to us, telling me where to go so I can navigate through the mouth and take our pictures as we go. The first two pictures are the most important. They create a topographical of what we're doing. The next picture we take is the distal of the adjacent tooth, and that's creating a three-dimensional of the distal, so we can create our contacts, interproximal contours. Then it works our way around taking a series of pictures that show the teeth from different angles and allows us to get the three-dimensional image. As we work our way around, the picture that you're seeing on the screen is created by a simple viewfinder like on your digital camera that you may have at home. It has nothing to do with the actual picture that's being taken. That just allows me to guide the camera through the mouth. As I push the foot pedal, it starts a series of lenses and mirrors inside the camera that move back and forth. I'm taking approximately 300 slices of information with 100,000 points in each picture. At the end of the process, each picture is overlaid or laced together to create the three-dimensional image that we'll see at the end. In the upper left-hand corner of the screen, it tells us where we want in writing where we want to be, and there's also a cartoon in the upper left that shows us where we need as well. In the lower left corner, you can see a picture of what you have just taken. If you look at that and something doesn't turn out right, you can delete the previous picture and create a new one representing the same information. So looking down in this area, excuse me just a sec, if I see that I'm missing some information back in here, or say there's something not right here, I just push a pink button, ask me if I want to delete the scan, which I do. Push the other button, I can go in and take another one. This is a huge time saver if I ever needed to retake an impression. In my office it takes about 20 minutes, half an hour to redo the cord and all the things we need to do. With this, it takes about 10 seconds. We've captured all the teeth on the top like we would with a check bite type impression. And now we're working our way around the bottom.
45 degrees, you look to 20.
You can see as we're going through the crosshairs, you try and line those up on the center of the tooth that they're asking you to take the picture of. Not 100% necessary to be perfect, but you want to get about as close as you can get. I'm going to have you close to your bite for me. This is the bite relation that relates the top teeth to the bottom teeth. Try and line the line up across the occlusal plane. And they actually take 2 of these pictures to establish the bite.
Please wait while scans are saved.
Typically what I like to do at this point is show you what we've done inside there. This is basically you standing on your lower teeth looking straight up. So these are the 2 teeth that we worked on today. Each picture takes about 300 slices. It's talking at us. Has about 300 slices and holds about 100,000 points of information. Each one of those pictures is laced together by the computer program to create this 3-dimensional image that you're seeing here. This is you standing on the lower teeth looking up. I'd like to take and show you what we can do here. As we turn it this way, this is you looking from your tongue side out. This is you looking from your cheek side in. Where I get most of my information is actually turning it inside out. And I turn it all the way around nice and slow, making sure that I've got my marginal adaptation everywhere I need it, and that I've got a little bit of root structure captured below where my margin line is. As I turn it this way, you can see basically how the teeth line up and how the bite comes together. As I push this part, this is your lower teeth and how your bite comes together. You can spin it all the way around, look from both sides. If I need to see something more closely, I can actually blow it up and make it enormous on the screen, giving myself a little bit more precise picture to see if anything's missing. And if it is, instead of taking another impression, you've had those before, I can actually go and just take one more picture and it solves our problem. Just like that. Then all I do is press send, and it's digitally sent off to the laboratory. As you can see, the Cadent iTero digital impression system has a multitude of benefits. In my practice, I've shortened seat times with less remakes. The wow factor is a great marketing tool for patients, and most importantly, the crowns themselves fit more accurately than I could have imagined. Thank you.